Hello everyone, I'm Dr. Yaron Wu. My Chinese name is亚儒. We're going to talk about lower back pain today. If you want to see me in my clinic, that's the clinic address, 3350 Scott Boulevard, Building 47 in Santa Clara. So today the seminar, when we talk about lower back pain, number one, we're going to talk about the cause, why you have lower back pain. Number two, we're going to talk about, we'll give you a quick exam during the break, so you know which type you belong to. We're going to introduce you all kind of different lower back pain. Then, of course, you're interested to know how can I fix it. First thing is, if you know why you have lower back pain, you should know what you should do. Not before you see me. You have to do something you should do. Stop the causing of lower back pain. Then we're going to talk about how acupuncture can help you. And we're going to give you a special offer at the very end. So if you want to do something with us, you're welcome. As a thanks for your time to be here. Before we start, let's introduce myself. I'm licensed in California. I practiced 22 years already. This is my 23rd year. And I have a doctorate degree in the United States for acupuncture and Orient medicine. I was training in China for 6 years, MD and acupuncturist. That has been in China over 50 years. They train both. You have to understand Western medicine to be a good acupuncturist. The fact is, in my class, the college one, all the boys become surgeon, or the girls become acupuncturist. So I was the rare one to be acupuncturist. And in China, not only my school was the best one for acupuncture in Beijing, I got an apprentice training. What happens in China, they believe you have to be hands-on to be a great acupuncturist. Most time you follow some big masters. And I'm a public speaker, includes Stanford, UCSF, UCLA. I've been giving lectures talk about acupuncture. And I'm a public speaker for health. And on radio, 96.1 is for Chinese, 1170 is for Indian community. Any health topic, if interesting, feel free to contact us for your company, for your temple, for your church. We're willing to talk about health. The whole thing is, we believe health has come from the concept. You know the right thing to do, you can keep health. You don't know what to do right, you will have problems. It's just consequences. Before we start lower back pain, let me ask a question. How many people had lower back pain before? How many here? Okay. How many have lower back pain now? Okay. Ask a question. When you're 20 years old, or when you're at 40 or over 40 years old, what's the difference with your lower back pain? Any comments? Recover easier. What time? 40 or 20? 20. How many people experience when you were 20 or teenage, I twist my ankle, sleep overnight, I'm fine. When my lower back hurts 3 nights, when I get up, I'm fine. How many people? None? You did not have lower back pain, or you didn't experience that recovery? I feel, right? Why, when you were 20, you don't need to see me or somebody? You can sleep overnight, a couple of days, your lower back the pain getting better. Why now you have to come here and then say, I still have lower back pain now? Why?
There will be a lot of activity during Mondays. Kids will keep on.
A lot of activity, exercise?
Yeah, they have more flexibility. But now
so your body can fix yourself much better, right? Does that make sense? Basically, the why we ask this is a lot of patients will come back see me and say, Dr. Wu, my lower back pain just never gone. I fix it, doesn't matter, chiropractic, acupuncture, massage helps. But it will come back a couple of days later. A lot of times they ask me why. I would like to ask them why. That's the difference. What happened is, if you know when you are 20, you're able to recover by yourself. And now when you're 40, 50, 60, you're not able to. That why is the real question. You start getting what I'm talking about? That question is, do you still have the ability to recover? Which means, are you healthy or not? If you are healthy as when you were 20, you can recover like when you were 20. Start getting my point? If your body is acting like 60 or 80, your lower back pain will not recover like when you were 20. Make sense? That will lead a question to why lower back pain is not recovering to another question, are you healthy? That make sense to you? How many people think you are healthy? Generally speaking. Let's find out. In Chinese medicine, we believe people have at least 4 stages of health condition. Generally speaking, people will say, I'm healthy, I'm sick, right? In Chinese medicine, no. You can divide more. When people talk about they're healthy, still have 2 kinds. One is when you were teenage or when you were in college, 3 nights no sleep, get up, take a nap, ready to go. Boy, twist the ankle, sleep 2 nights, yeah, I'm fine. Make sense? It's called healthy. Or we call strong. You're healthy, in good shape. Second thing, everybody here, some point probably experiencing your life. You know, I get up in the morning, say, honey, I didn't sleep well last night. I feel tired. Do you have any symptoms? No, I don't have any pain, but I'm just tired. I need to sleep. Or if you send me to Hawaii 2 weeks vacation, I come back, I'm energetic. I'm like 20 again. Make sense? Chinese medicine called weak. You're not so strong as you used to be when you were 20. Make sense? Then you come to a point and say, I use computer 10 years at Google, Apple, 12 hours a day. I got up in the morning, honey, my neck hurts. Well, go see doctor, my lower back hurts. We'll have some symptoms after I eat, I feel bloated. My sex drive goes down. I couldn't sleep well. For women, my period hurts. All kinds of symptoms. But when we go see a doctor, you know what happened? The doctor say, Miss so-and-so, Mr. so-and-so, you're perfect. Because all your lab tests, your x-ray comes out negative. How many people experience that frustration? You don't feel good, but you see an MD, they say everything fine. You know what that means? In Chinese, it's called 亚健康. English called unhealthy or not healthy. We don't say you are sick, but you have some symptoms already. There's a complaining there from your body. Make sense? Then you come down to a point, you go see MD, they say, sorry, your disc is in trouble for lower back pain. You have degeneration. Or for female, you have fibroids, diabetic. Some people, cancer, tumor, stroke, heart attack, whatever. That point, doctor will say, sorry, something broke, we need to fix it. Either you need to be on medication, drugs, or you need surgery. Unfortunately, with medication or drugs, what does it do? Does it cure your problem? For example, high blood pressure. When you take medication, what happens next? Your blood pressure is controlled, right? But can you stop the medication? Why not? If you stop getting higher, right? It's a mask. It covers the symptoms. I never heard anybody stop drugs or medication, their blood pressure goes down to normal. It covers the symptoms. It makes numbers looks good, but it's not a cure. Does that make sense? Okay. Now we'll come back when we talk about health. Put it this way. How many people think you're still healthy, strong, healthy? Like when you were 20? How many people think you're weak? I don't have any complaints, but I just feel like I'm not so energetic when I was 20. How many people think you're unhealthy? I have some complaint. Doesn't matter, neck pain, lower back pain, I sleep as trouble, after I eat, I bloated. When I come period, I feel so tired, but you have no lab test positive. How many people think you are really sick? It's not you say it. It's MD say, I'm sorry, your lab tests come out like this. How many people? If your disc has a problem, you belong to that group. And in Chinese medicine, what we believe is this. When you are healthy when you were young, you're like millionaires. You're rich. You can spend your health any way you want. No sleep, no problem. Junk food, no problem. Ice water, no problem. Why? Whatever I eat, my body shape looks nice. But how about when you're 40? You had a big dinner, 2 weeks, yeah, something coming up on your belly, right? You know what I'm talking about, right? Chinese medicine believe you're poor. Your health is spent to a point. If last night you didn't sleep well, you do not have the energy for today. Then it comes down to a point is, I have neck pain. Get up in the morning, there's pain. I get up in the morning, my lower back hurts. That means you're in a credit card bill. You wake up in the morning, the bill is there. If you don't pay back, anytime they were chasing after you. Does that make sense to you? Then you're to a point is bankrupt. What does that mean? The MD, just like the real estate agent, when they check your credit score, your credit score is broke. That's the MD lab test. Does that make sense? A millionaire, a poor guy, a guy with a credit card bill, all can have very good credit scores. Does that make sense to you? Does that make sense to you? That's the point when we talk about health. You see, my MD told me I have no problem. It's just telling you your credit score is fine. Mean nothing about your health. Doesn't matter you're poor or rich. Does it make sense to you? That's what happened. That's also the misunderstanding I tell all my clients. For doctors, when I was in school, trained as MD, we only talk about disease. Only when the lab test show up positive, we do something. For example, we have diabetic. How many people heard pre-diabetic? So what can you do? Any medication? Go exercise, watch your diet. What does that mean? It means you're not broke enough, so it cannot fix you. Does that make sense? But for Chinese medicine, when you're weak, when you're a poor guy, we're going to tell you, come on, let's save some money. Your health is in trouble. You don't want to be in the credit card bill. You don't want to be bankrupt. Does that make sense? That's the whole concept, completely different. Now we'll come back, discuss the lower back pain. Why, when you were 20, your lower back pain can recover by itself? Why? Because you are rich, right? Just like in Bay Area, buy a house, you're billionaires. $1 million is not a problem. Come on, give you a check, it's done. Does it make sense to you? Why now you cannot recover when you're 40, 50, 60? You get up in the morning, you have lower back pain, you're in credit card bill. Buy a house in Bay Area? Forget it. You got my point? Health is the primary reason why you recover or why you do not recover. Do you agree? That's the reason I talk to my clients in my clinic a lot of times. You have to be logically reasonable to discuss why my lower back is not getting better. Then you ask, Dr. Wu, everybody was rich, right, when we were teenage. Hopefully at some point in your life you were, right? Now what happened? Why my health keep on going down from billionaires to a poor guy to credit card bill, and now my lower back chasing up me all the time? Make sense? Everybody actually have 4 health accounts. In Chinese medicine, we discover if you don't take care of these 4 accounts, your health will go down because you are ruining or spending your money. Number 1, sleep. Number 2, diet. Number 3, exercise. Number 4, stress. We're going to go through quickly, and all this one we're going to discuss more detail in our health seminar. So number 1, you need good sleep, enough sleep. Number 2, you need a healthy diet. Number 3, you need correct exercise. We're going to discuss more. Some exercise not help lower back pain, but cause lower back pain. Does not mean you exercise, you'll be healthy. Does that make sense? Number 4, how's your stress? How about sleep? Let's do this simple math. How many hours you guys sleep? How many people sleep more than 6 hours? Raise up your hand. How many people sleep more than 7 hours? 2 guys? 4, okay. How many sleep more than 8 hours? How many people sleep more than 9 hours? A kid, okay. How many hours sleep do you think you need? 8. Common sense. Most people believe 8 hours, right? If you want to sleep 8 hours and it's enough, there's one thing. You have to have good sleep quality. In other words, you cannot lay in a bed 15 minutes or 1 hour saying, I'm still not falling asleep. Your 8 hours does not count. Make sense? Now, what time do you go sleep? How many people go sleep before 12? How many people before 11? How many people before 10:30? 10:30 is the latest time you should go to bed. Because 11 to 1 o'clock, your growth hormone here, you know, Indian lady like to put a red dot here. It's growth hormone inside here. Release 80% if you are in deep sleep during 11 p.m. to 1 a.m. You know what happens if you don't go to deep sleep? The growth hormone cannot release 80%. This is the government of your whole body's hormone. When growth hormone release, thyroid, pancreas, sex hormone, everything, adrenal will follow. Remember, United States government closed for 2 weeks? That's what happened. Every night you shut down your government. That's also the reason for girls, because women are more sensitive to hormone. Why, when you not sleep well, next morning everybody say, oh, you didn't sleep well? Because your skin, your body are more sensitive to hormone. Make sense? For men, our skin is a little darker, thicker. But the function, the outcome is the same when you sleep late. Make sense? Now when you calculate, if you need 8 hours sleep, when you sleep 6 hours, what happened? Every single night, your recovery has 25% left. Does that make sense? When you sleep 8 hours, that's 100%. When you sleep 6 hours, how many percent? 75%, right? So every night you own 25% work need to be done. Guess how many you save it up after 20 years, 30 years? How much it accumulate? Make sense to you? That's the reason we keep on talking on radio. You want a health, at least go sleep. Sleep enough. Otherwise, you don't come to blame a doctor and say, why my health is in trouble. Of course. You ruin your health by not sleep. Does that make sense? Next one, diet. What to eat? How many people drink cold water? Raise up your hand. How many people like ice cream? Okay. How many people eat a salad you think is very healthy for you? Okay. This is everybody's favorite part, right? Fruits. How many people think fruits is healthy for you? Wow. Tastes good, right? You know what happened? All these things slow down your metabolism. You should treat fruits as candy. Have you ever seen somebody eat a candy, half-ball candy is put in? Nobody do that, right? But how many people try half watermelon? You get my point? In Chinese medicine, we believe your digestion system, any food or drink you put in your mouth until it comes out, just like a cooking pot. If you want to cook the food very well, get it completely done, well done. You should not put anything cold or raw to slow down the process. It's like cooking. You don't want to cook rice and put some cold water in there, right? In the middle. Same thing. So what happens in Chinese medicine believe if when you eat rice or wheat, which is sugar, hypercarbohydrate, when your metabolism has trouble, you get diabetes. When fat cannot digest, process well in your body, you get high cholesterol. And when protein, meat, we cannot process well, you get a gout. Does that make sense? This is supposed to be process, digest, discharge, well done. Does that make sense? So when you say I have a digestion issue or I have a high cholesterol, diabetic, gout. Chinese medicine believe your cooking pot, when you eat a food, is in trouble. Simple, straightforward. Make sense to you? That's also the reason why your metabolism is in trouble. If you understand very simple, metabolism, whatever you eat, are you able to intake energy, become part of your body to use it? Does that make sense? So if you don't want to slow down your metabolism, you do not want to eat anything cold or raw. Make sense to you? Try to get it done. Break down the structure outside your body. Well cooked outside your body, so you don't have to do a lot of work inside your body. Does that make sense to anybody? Does that make sense? Okay. So in China, it used to be, when you have a big belly, people believe you're success, rich. How many people believe that today now? It's a sign for a health problem, right? What happens is your metabolism slow down. Your body weight go up. In Chinese medicine believe, we find out when your metabolism goes down, you start pack the trash in your body. Make sense? Okay, talk about sleep, talk about diet, and next thing, how about exercise? How many people exercise, by the way? Half? Less than half? How many people exercise 5 times a week at least? 3? How many people exercise and get a sweat every time? 2, 3? Okay. When you exercise, you have to exercise at least 4 times or 5 times a week. You cannot say I exercise 3 hours on weekend and nothing in between. That's even worse. Your body not able to adapt it or adjust to the frequency. Now, what's the best exercise for lower back pain? Any comments? Swim? Okay, part of it. Walking? How many people walk, then your lower back getting hurt more? A few? Swimming is good, build up your muscle, but for most people, stretching is better. And if you want to do, ideally it's Tai Chi. Slow, relaxed exercise. We're going to explain to you why. Exercise at least has 3 types. Number 1, sports. Swimming, jogging, running, biking, basketball, football, soccer, whatever. You have to run, move a lot. But where the blood goes when you do sports? Muscle, limbs, right? So you build up, your muscle looks good, you're fit. Second one, stretching. For sports, most time the muscle is constructed, right? Stretching, the muscles go opposite. You stretch. When you sit a long day in front of a computer, do you think you should sports or should stretching? Actually, both. But stretching need more. Does that make sense? And if you want a health, what you should do? Chinese medicine find you need to do Tai Chi. You need to exercise and bring the blood to your belly, increase your metabolism. That's for health. Actually, sports is for strong. You build up muscle, but strong does not mean healthy. I'm going to explain more later. But keep in mind, when you look so strong, does not necessarily mean you're healthy. You get that point? Okay, now I'll come to the very interesting part, stress. People talk to me a lot of time, like I sit a long time, I have stress. Actually, when I sit a long time with a certain posture, you build up tension. Stress, a lot of time talk about mental. Tension, most time talk about body. But what happens, your mental stress expressed through your body tension. Do you agree? So if you're in a company, if the company is ready to lay off, you look at everybody's posture, you can see everybody's tensed up. Does that make sense? But if you go Hawaii Beach, can you tell everybody's happy, relaxed? The posture will show it, right? Then what happened this? Doesn't matter stress or tension. Will give you an outcome, make your body tensed up. Do you agree? So for this, actually stress have 2 parts. We give an example, for example, a VP in a company. Very high position. I don't need to do program. I don't need to do some detail work. I don't need to carry anything heavy, right? Do you think their body is relaxed? Physically, they don't have a lot of workout, right? But mentally, if you want to be a VP, do you think it's an easy job? That's really very interesting in our clinic. We have CEO, we have VP, very high position, you know, got $1 million pay a year, come in to do treatment. You talk to them, it sounds like they do nothing every day. But you touch their back, you know what happened? It's like a rock. Their stress is through their body. If you work 16 hours, even if you think your job is an easy job, do you think the stress or the tension build up is more than 8 hours? Yes or no? So in my clinic, it's very interesting. A lot of time I talk to people, your stress level is too high. No, I work this job 15 years already. It's fine. But I think just like a car, you heavy loaded, just like a big truck. I can carry a lot. But when I'm heavy loaded or I have nothing loaded, is the truck feels different? I can handle the job. Doesn't mean I do not take stress. I'm just used to it. Does it make sense to you? So that's the thing when I talk to my client in the clinic, I say, how's your stress level? 0 to 10. A lot of people say, maybe 5. I'm okay with the job. I worked there 10 years already. Most time I will add 2 or 3 on top. Make sense to you? When people say, my stress level is 7 to 8, I mostly take a 10. In Bay Area, everybody's smart, everybody work hard. Or you're saying like, everybody work hard here, everybody work 12 hours. But doesn't mean your body can take it. That's when everybody got sick. In the Bay Area, the youngest one I saw got a stroke, 37. How many people over 37 now? Typical software engineer, 37. The youngest one got a heart attack, dropped dead. The one I know, the youngest one, 41. Make sense? That's what happened, the reality here. So if you don't take care of your health and you're on a high stress level, you will know even you can carry it, you can handle it, but doesn't mean your body is happy with it. Does that make sense to you? Okay. Then we'll talk about lower back pain. Why lower back pain is so common today? Did you guys get an idea? If you sleep 6 hours only, 25% short every day. If you work 10 hours, 12 hours, by the way, how many people work like over 40 hours? Raise up your hand. A week. How many people work over 50 hours a week? How many people work over 60 hours? Then you might need to quit your job first for lower back pain, right? I'm sorry to say so, but of course it's contribution. Does that make sense? Now why is it so hard to prevent? Income. Because your job, right? Again. So many things get involved in your health. It's not only the lower back, the muscle, the posture. It's part of it, outcome. But you have to think about your sleep, your diet, your stress, your exercise. If you do not do it right, your health goes down. If every single account you're in trouble, guess what happened? Your body crash, right? Just like money. Every single part, you don't make money, you keep on spending money. Of course, you get bankrupt. So basically what happens with your work, with your sleep, lack of sleep, not correct exercise, eat wrong diet, your metabolism goes down, your regeneration ability goes down, your recovery will go down. That's the reason why you have lower back pain. And you're not able to be 20 when you were 20, sleep overnight, my lower back pain is better. Now we'll come to the conclusion why you have lower back pain. Number 1, posture. Of course, when you sit there 12 hours, your muscle build up tension, you have lower back pain, right? Second one, stress. How many hours you sit, how many hours you work, and how's your stress level? If your stress level is high, you can feel your body, emotion-wise, getting more irritated. Make sense? And sleep, get in trouble. Of course, if you don't sleep enough hours and you do not have good sleep quality, you do not have the recovery ability. You don't even give your body a chance to do it. Make sense? That's diet. If you're dieting, ice water, ice cream, salad, fruits, coconut water, lemon juice, all kind of things like that, or tea, coffee, bring down your metabolism. The slower your metabolism, the more body weight you'll gain. Make sense? And now, of course, if you don't know what exercise to do, how can you fight lower back pain? Does that make the point? That's the thing. For lower back pain, actually, a lot of people come to see me when you have severe lower back pain. Actually, before you have lower back pain, you should know if something is coming. We give you a very simple test. Try it out. You can tell if lower back has issue or not. By the way, it doesn't matter your neck or lower back. Right this moment, if you sit here, if you can feel it, you are in trouble. You don't need to feel pain. The reason is neck and the lower back. It's called posture muscle. When I'm standing here, keep my posture, right? I don't need to tell my lower back, come on, stand straight. Otherwise, I'll crash. It doesn't happen that way, right? So the posture muscle, your body trained, ignore it if there's no problem. I can stand here straight. I don't need to tell myself every single minute to adjust it. That's called posture muscle. If I stand here and feel my lower back, wow, there's something going on. Doesn't matter, aching, weird, numb, tight, something is going on. Make sense? And when you do any simple range of motion, when you move around, you should not feel anything neither. Let's try. Everybody sit front a little bit, in front of the chair. When we say up, you go up, go backward. Do you feel anything in your low back or your neck? Just go back as much as you can. And down, forward, as much as you can, slowly. Okay, get up. Just keep in mind, if you feel anything, there's something going on. Then turn left. Turn your whole body left, slowly. Okay, then turn around to right side. If you feel anything, keep in mind there's something going on left or right side, okay? The last one, turn your body sideways to left. Use your hand, just touch the floor on left side. Straight, very straight. Go one side. Then go right side. How many people feel something hurt? How many people feel stiff? Left or right or turn up and down, whatever, I just feel stiff. How many people feel different, left and right? You're not doing the same thing. You know there's something going on with the lower back. You should not feel anything. Make sense? You don't need to come to see me when your lower back hurts. You need to keep your body feel nothing. Most people use computer like this, right? Is that common? You know what happened really every day? How it ruin your posture? How it start make your posture muscle in trouble? That's what happened. You see the hunchback? Is that typical in your office? When you look at your colleague? Make sense? Okay. How many people heard a story about a frog, cooking a frog? What happened this? If you put a frog in the hot water, threw it in, guess what happened? They jump out. Why? It's hot, right? But how about you put in cold water and start cooking water slowly? What happened? They feel jacuzzi, right? Until well done cooked, right? That's what happened to your neck or lower back. One day is not a problem. How about 10 years? When you say, Doctor, my posture is a little weird. Doctor, my lower back hurts. It's a well done frog. Has been cooked a long time. And a car accident is like you threw a frog in the hot water. So I guarantee 100% people have a car accident, you'll go see a chiropractor or acupuncturist because pain, right? Suddenly the pain makes you want to do something. But a chronic one, most people ignore it. Well, look at the spine. That's the spine. That's the lower back one. That's the whole spine. That's the from back side. That's from side. And what happened this? Because the lower back, the curve is more straight. The neck is more typical, so we use neck instead. Which one do you think is the normal one? Or the spine curve? This is sideways. When I'm standing like this way. Which one is the normal one? How many people think the left side, the one on my side, is the normal one? How many people think the middle one is normal? How many people think the right side is the normal one? How many people don't know? At least from this seminar, you can learn this, which will help you a lot in the future. The very right side, from your view, is normal one. That's perfect neck curve. If somebody just graduated from college, I'm happy, got a job at Google. You take X-rays like that. Second one, I'm an engineer. I'm in charge of a small team. I worked 10 years at a Google, Apple, Applied Material, whatever company. Then what happened? You every day use computer like this, right? You stretch your neck forward. In Chinese medicine, we make a joke. It's called chicken position. The chicken when they walk, their head is forward, their head is stretched out. When they stand there, their head is still forward. Have you seen many people stand like this? Their head is in front of their body. Now, after you work 30, 40 years, you say, I'm retired from Apple, Google, or whatever company. You have a hunchback like this. We call it turtle position. If you look at anybody in your company like this position, they're a senior engineer. You don't need to look at them front. You can look at their back, senior engineer. Make sense to you? But what happened is the bone has a problem? No. All these three guys, anybody, you think the bone has a problem from the very beginning? Now, why the posture keep like this? What the thing decide our posture? Is the bone, the nerve, or the muscle? You cannot see the muscle here, right? But guarantee you can see this guy's muscle is very tight, that one is in trouble. What happened? The bone is just like blocks on top of each other. You're not able to move the bone itself, right? The muscle, soft tissue, hold them together. When your metabolism goes down, when your recovery, regeneration goes down, your body not able to keep the bone together as it should be, you start develop some problem. Then you have this curve. If you want to treat the bone, doesn't matter, you do surgery, cortisone shot, does it help? You're not dealing with the real problem. That's what happened. So what decides your posture? Your muscle. What keeps your posture? Your metabolism, your recovering ability. And this is a chart. We're going to show you how your body or your muscle is tied up. We're going to test something. The first one for this one, just want to show you how acupuncture look at people. Everybody cross your leg. One leg on top of another one. And relax. Now what you do is touch the muscle in front of your leg. Can you feel the softness? This muscle right is soft. Now you touch the side of your thigh. Compare it, rub it. Which one is tighter, more tight? The thigh. How many people feel the thigh is more tight? Raise up your hand. You know why? This picture shows you from the second small toe. There's a channel called gallbladder channel all the way coming up from the side of your body to your brain. And I guarantee either you use computer every day or you're a mental worker. That's why the thigh, the muscle is more tight. Make sense to you? That's one way we determine if your body is tight or stressed out. If you want to know if your body is tense, number one, you can check from your neck. Easy way is touch here. This part muscle, a lot of people can feel like rock, or if you touch it, hurts. Make sense? That muscle indicates your neck muscle is tensed up. Doesn't matter if from computer or mentally stressed out. Second one, if you want, right now I'm going to take a break. During a break, you can ask a masseuse check your neck or lower back muscle. You can feel if it's tight. If it's tight, you know your body is tensed up. The most easy way is to go home, lie in a bed, face down, ask your spouse or a family member, rub your back. In the middle is the spine, right? Right next to the spine, there are two big piece muscle. You rub it. Even relax, you can feel some people like a rubber stick, very tight. The more tight, the more tensed up your body. Make sense? And next one, we gallbladder channel. We just try it out on the side. So go home. If your husband's a software engineer, just touch the side of the muscle, say, honey, you're stressed out because the mental work. And the last one, very interesting. If you go home, take a shower, you look at your navel. You know, navel is a round shape, right? If on your navel has one wrinkle, goes to right hand, your own right hand. Look at the mirror, wow, it's a long line. You're stressed out. That's a sign in your body to tell you your stress level. And I have one lady come back and say, Dr. Wu, I have a wrinkle 2 inches, very long. You're really, really stretched out. Well, some people say, I have 2 lines, not only 1. What's that? On your navel, you know everybody has navel, right? On the navel, if you have a wrinkle, a line, goes to your right hand, your own right hand. Anybody? If you look at husband, to your husband's right hand has a wrinkle. The longer, the stressed out you are. Make sense?
Only one side?
On right hand.
So you won't see
Around the navel, different part means different thing. But on the right side is related to stress.
Oh, okay.
Make sense to you?
The wrinkle,
Very accurate.
the wrinkle on right side of navel.
Yes. If here is my navel, I have a line like this. A wrinkle comes out. If you check it, you can see it. Very accurate. Okay, if you want to know, you see, I don't know what to do to find out if I'm tensed up. We're going to give a break, give a brief exam. Then you can find out what's going on.